All these myopathies will have generalized hypotonia, no doubt among that. Weakness can be present at birth or it can appear a little later in the infancy, and it is a progressive clinical course, but it is a slowly progressive clinical course they will have. And the clinical picture, it is a spectrum. It can range from a severe neonatal form, that is at birth itself the child has respiratory failure needing invasive ventilation, or the child can have a mild childhood onset form where there is a non-progressive weakness, only the child needs some assistance in walking. So it is a spectrum of disease. So here you can see two pictures, two images of babies with congenital myopathy. In the first image, you can look at the picture where in the prone position the baby is not able to lift the head, okay, and a rounded back is present. The second picture, the picture at the bottom shows arthrogryposis. So it's a severe neonatal form, okay. And history, again very important, natal history, antenatal history. So how was the pregnancy period? Was there history of reduced fetal movements? Was there history of polyhydramnios? And at birth, look for arthrogryposis, look for clubfoot, very important. And presentation, again breech presentation most often is the common in these babies. So on examination, there will be hypotonia. The children will assume a frog-like posture if it is very severe, and they will have feeding difficulties, they will have sucking difficulties and respiratory insufficiency. Facies, again in severe forms there will be typical myopathic facies. So similar facies we have seen in our myotonic dystrophies also. So all this is because of the facial weakness. The patients have a expressionless face, they have ptosis, a long face literally with temporalis wasting, masseter wasting, open mouth, this is tented upper lip, and they can also have a high arched palate because of the weakness of pterygoid and temporalis muscles. So this is a typical myopathic facies which is very similar to myotonic dystrophies and what we see in muscular weakness phases. So the challenge that we face in these children are although there is a very slow progressive muscle weakness, but the bone and joint deformities will be present, and without regular stretching or without regular physiotherapy rehabilitation, these can go for contractures. So these children can have joint contractures, they can have lordosis, scoliosis or a rigid spine. So thorough evaluation and a regular follow-up with an orthopedic and a physiotherapist is very important. So the first type under congenital myopathy is our nemaline rod myopathy. So why this name nemaline rod myopathy is, in the muscle biopsy you can see that there are small rod like inclusions. I will show you a biopsy picture. You can see small rod like inclusions in the muscle fibers. So what are these rods? Basically these rods are nothing but those components of the muscle only, like alpha actinin and other Z band filaments are all included. They combine, they become clumps and they form the small rod like inclusions. This can be stained under Gomori trichome staining and we can visualize it. This nemaline rod myopathy is particularly common in one ethnic group, that is in Ashkenazi Jews it is quite common. Again, nemaline rod myopathy can be congenital, can present as very severe like this child, where the child needed invasive ventilatory support very early in age, or they can be a mild phenotype also. And apart from the feeding difficulties, apart from the respiratory difficulties, some children can also have a dilated cardiomyopathy, right? So this is one point that you have to note. And of course, there is no treatment as such. We are only going to support these patients. So this image shows two brothers who are suffering from nemaline rod myopathy. Here you can see that these children are not very severe like this first child, isn't it? So these children are able to stand, they are able to walk, they can even lift. That is not much of a proximal muscle weakness. They can even lift their hands. Anti-gravity movements are also present. So this is the heterogenic nature of nemaline myopathy. And so mostly we have seen all those. Yes. So the facies can be present, respiratory involvement. Yes. So all those, do not worry that these are quite confusing. Just remember, congenital myopathy is also an important neuromuscular disorder. You have to include in your differential diagnosis of a floppy infant. And these myopathies, the different names are based on only the muscle biopsy picture. So what you can see here is the nemaline rods in the Gomori trichome string. So these are the rods. These are nothing but rod like inclusions basically of the actinin and Z band filaments, right? So these are the nemaline rods.